Most cities and counties here in our area have lifted their mask mandates after the CDC said fully vaccinated people no longer need to wear a mask. Meanwhile, COVID-19 cases, hospitalizations, and deaths have been on the decline in the Kansas City region since the start of the year. This is data from the Mid-America Regional Council. But still, we've heard the concerns from a lot of you about taking off your mask, even if you are fully vaccinated. So to help answer some of our questions, Dr. Dana Hawkinson from the University of Kansas joins us live this morning. Doctor, yesterday on the University of Kansas Health System's daily COVID-19 briefing, you all kind of took an informal poll of the folks who were watching, and 76% of the viewers said they were still concerned about that new mask guidance from the CDC. Do you think there's somewhere in the recommendation where the CDC could have been more clear, or how can we continue to navigate this?
Yeah, I think it's difficult. You know, the CDC, for one reason or another, you know, there have always been differing opinions. You're moving too slow, now you're moving too fast. You know, I think they are trying to do the best they can with the data that they have. And certainly if you are fully vaccinated, the data suggests and they say that you are well protected against that whole spectrum of COVID-19 disease, all the way up to hospitalization, severe disease, and death, of course. But that's for fully vaccinated. You have to understand that a lot of people, and we know this just from the vaccination rates, there are still a lot of people who are not vaccinated, and that includes people from 20 to 50 who are probably going out and being in those social situations, but it also includes those younger pediatrics as well. So I think it is important for everybody to understand what their risk and their level of comfort is. We know this pandemic this past year has brought about a lot of stress for a lot of people for many reasons. You know, this new guidance is hopefully helping to reduce some of that stress, but we still understand you can identify risk versus benefit. And if you feel comfortable taking off your mask and you're fully vaccinated, that's one thing. But if you don't still fully feel 100% comfortable, then certainly keep your mask on. Try to avoid those other dangerous situations as well.
Let's talk about kids and going back to school. Right now, the CDC says kids should still wear masks in schools because, of course, most kids cannot get the vaccine yet. As far as the timeline for kids getting the vaccine and going back to school in the fall, what do you see potentially changing or not when we get to the fall?
Yeah, you know, I still do fully support the distancing, the masking, all those mitigation strategies, which have worked very well in that school setting itself. You know, as we get further into this and children are going to be able to be vaccinated, we certainly do anticipate that children as young as 6 months or even 2 years up to that 11-year mark or 12-year mark are going to be able to be vaccinated. I would certainly encourage that. I think that will help get to being able to get the masks off the kids, maybe reduction in some of that distancing and some of those things that have become more sterile within the past year in that school setting for health purposes. So I think, you know, anticipating that children will be able to get those vaccines, especially the Moderna or Pfizer. We know Pfizer is now down to 12 years old. When we can get that, getting those children vaccinated, just as they would get vaccinated for chickenpox or measles, mumps, rubella, is going to be important. That will help keep them safe. That will help keep them being able to participate in extracurricular things such as school or chess, not school, but sports, chess club, camps, other things that are outside of the school setting itself, because we know that school-age children in those types of settings is where we saw a lot of the spread of disease, even when schools were open, because schools were continuing that mask, the distancing, all those mitigation strategies. But we know that kids were still getting together outside of that school setting. So this will help keep them from having to miss participation days if they can get vaccinated when it is available to them.
And Doctor, last question is for anybody who might be immunocompromised. Should they still be wearing a mask even if they are fully vaccinated?
Yeah, I think it goes back to that first answer and that first question as well. Continue to evaluate the risks and benefits of what you're doing. We know, and I've worked and talked with one of our transplant nephrologists, Dr. Jeffrey Klein, yesterday. He's working on things and protocols for his patients because we know up to a third or more of immunocompromised or solid organ transplant patients may not develop that robust immune system and that immune response to the vaccine because of their immunosuppressive regimen. So I think it's important to understand that risk and benefit. What is the situation you are going into? Are you confident 100% of those other people are vaccinated? If not, then maybe don't bring things indoors just yet. Continue to do things outdoors. Continue to mask when you can. I think it's going to be down to that individual, and also extremely important is going to be talking with their individual medical teams and their physicians to really help keep them safe and keep them out of the hospital, just overall keep them from being sick.
Dr. Hawkinson, thank you very much for joining us this morning.